Good afternoon. We're going to start the webinar in just a second. Good afternoon, everyone. Thanks for joining us. We're just letting a few more folks in before we get started. If you're here for a webinar focused on addressing factors contributing to child and youth mental health challenges, you're in the right place. I'm Amy Rowling McGee. I'm the president of the Health Policy Institute of Ohio, and we're glad to have you all here with us this afternoon. HPIO is an independent and nonpartisan organization with the mission of advancing evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending in Ohio. I'd like to take a minute to thank our core funders who advance our mission with their steadfast investments in our work. And I'd like to especially thank the Harmony Foundation, who funded the work that we'll be discussing on today's webinar. Thank you also to the organizations who have generously supported HPIO's 2025 Education and Event Series. We'll have a little time during our hour together for Q&A. As our speakers are presenting, please feel free to type any questions you have in the chat or the question box, and we'll address them as time permits. And then we'll also have some poll questions for you all at the very end, so please stick around for those as well. Today's presentation slides will be available on the HPIO website, and they can be found by clicking on the Events tab on our website. Children, adolescents, and young adults are at high risk for mental health challenges due to the brain development and physical, emotional, and social changes that happen during this time of life. Many children go through difficult times, test boundaries with their behavior, and feel anxious in some situations. Mental health conditions can interfere with a child's ability to bounce back from these obstacles. Rates of mental health conditions have increased in recent years among Ohio's children and youth, and they're associated with an increased risk of chronic physical health conditions like diabetes and heart disease, continuing mental health problems, and worse employment outcomes in adulthood. HPIO's series on child and youth mental health will focus on 4 policy briefs. The first 2 will be discussed on today's webinar. The third brief that will come out a little later this year will be looking at access to care across all levels of care and for different groups of Ohioans. It'll also analyze barriers to care that Ohioans are experiencing. And then related to that fourth brief, we'll be looking, or related to that, in our fourth brief, we'll be looking at payment and insurance coverage and how these issues impact access to care. The primary focus of today's webinar will be the 3 factors that are shown on the screen right now. These were 3, and these are absolutely not an exhaustive list of all of the contributors to mental health challenges among children and youth, but these were the 3 that we selected based on data and feedback we received from our advisory committee. So today we're going to be exploring data and actions that can be taken related to smartphone use and social media use, housing instability and homelessness, and child protective services and foster care involvement. We have a full agenda today, starting with an overview of our first two policy briefs from my colleague, Becky Carroll. And then we're fortunate to be joined by three speakers who will discuss the three factors listed on the previous slide. Each will describe steps their organization is taking to address mental health risks among Ohio children. With that background, I'm happy to introduce my colleague, Becky Carroll, Director of Policy Research and Analysis at HPIO, who will talk through our recent work on child and youth mental health. Becky?
Thanks so much, Amy. Welcome, everyone. Thank you so much for joining us. I love that you're all introducing yourselves in the chat. It's been very fun to see where everyone's coming from today. I'm going to start by sharing some prevalence data just to give all of you a sense of the extent to which Ohio children are dealing with mental health challenges. This data comes from our first brief in the series, and I'm only going to be sharing a few of the data points in this brief, but there are many others. So if you're interested, please go take a look on our website. Here we see the percent of middle and high school students who reported that their mental health was not good most or all of the time. And you'll see that this really peaks in 11th grade. This is the same data, but only for high school students, and it's broken out for males and females. And you'll see that the rate for females was more than twice the rate for males. This slide shows the percent of children with a mental, emotional, developmental, or behavioral condition broken down by income level. The overall rate for Ohio was 27%, and you see the highest prevalence among those children living below the federal poverty level. Here we have, there we go. Here we have some geographic data for the state. This shows the percent of K through 12 students enrolled in Medicaid with a behavioral health condition. So this is only for those students who are enrolled in Medicaid. You'll notice that we have a cluster of counties in southern Ohio with the highest rates. The highest percentage was in Lawrence County, which is way down at the bottom of the state. And there were 43% of Medicaid enrolled students with a diagnosed behavioral health condition. Here's some data related to depression. It shows the percent of high school students who reported consistently feeling sad or hopeless. We especially saw this among gay, lesbian, and bisexual students, with almost 3/4 of them reporting that they felt this way. And unfortunately, an outcome of this, we are seeing increased rates of suicide deaths among our young Ohioans. This data is for ages 0 through 17, and the rate has increased by 171% over 12 years. So as I mentioned, there is other data in the brief, including some data for specific conditions. But we are now going to pivot to talk about our most recent policy brief, which describes several factors that contribute to child and youth mental health challenges. And as Amy mentioned at the beginning, we know that there are lots of factors that contribute to these challenges, and it's going to differ from one kid to the next. As part of our research for this policy brief, we talked to 2 groups of youth and a family advisory council. Here were some of the factors they identified as contributing to mental health problems among children and youth. So one example of something that we really heard a lot in our youth focus groups was pressures related to school and feeling pressure to succeed. Here's a quote that really stood out to me. He said, "I struggled with perfection and living up to what my parents expected of me. So many times in high school, you think you need to be valedictorian. You think you have to get an A on this class. You have to be a 3-letterman athlete. You have to succeed in this and this." So some of our Ohio kids are really feeling a lot of pressure. We really wanted to dig into a small number of factors in this brief, and we chose topics that had evidence of posing significant risks, factors that contribute to disparities, and topics that are relevant to the current policy landscape and that we felt were actionable in terms of policy change. In addition to what we heard in our focus groups, we also worked with our advisory group and representatives from Ohio's legislative and executive branches of government. We ended up choosing these 3 topics that you see on your screen, and these will be the focus for the rest of today's webinar. You may not be surprised to hear that smartphones and social media were something that we heard a lot about in our focus groups, both from parents and youth. We see that Ohio teens are spending quite a lot of time on screens. In fact, that 12 to 17-year-old age group, who's represented on the far right, is spending the most time, with 63% of them spending 3 or more hours a day on screens, and 37% spending 4 or more hours a day on screen. And this doesn't include schoolwork. However, research has found mixed effects of smartphones and social media on child and youth mental health, given that there are both benefits and risks associated with their use. The effects largely depend on factors such as the amount of time that is spent, developmental stage, and the content consumed. So here are some lists of the potential benefits and risks. And I'm just going to be talking about a couple of these risks. Unfortunately, we know that bullying and harassment through digital platforms is not uncommon, and this is linked to depression. In 2023, 1 in 5 high school students and 1 in 4 middle school students reported being electronically bullied, and females were more likely to experience this than males. So if teens are spending more time on smartphones, they're interacting less with others in person, which can lead to more loneliness. Research is clear that social connections and having trusted friends and adults to talk to during tough times are really critical for positive mental health. This quote from a female high school student really stood out to me. She said that nobody at her school seems really happy. She mentions that they don't do a lot of things that make the students want to come together, and that the students seem to be kind of checked out and can't connect with other people. Before moving on to the next topic, I wanted to be sure to mention that the state operating budget bill that just passed earlier this month prohibited the use of cell phones in schools, with a few exceptions, but this is going to be taking effect on January 1st of 2026. Next, housing is another factor that we heard about in our focus groups. Secure, high-quality housing provides a foundation for healthy development and mental health across the life course. However, Ohio faces many challenges in housing affordability and availability. For example, in 2024, the average wait time for affordable housing across all HUD programs in Ohio was 25 months. This figure shows the percent of students who were homeless during the 2023-2024 school year. We see urban counties that had the highest rates of homelessness, higher than rural and partially rural counties, but we also see lots of high rates in Appalachian counties. Issues associated with housing safety, including the presence of lead in paint or pipes, can also affect child mental health. However, only 20% of Ohio children under age 6 received a blood level screening test in 2023, and the percentage has stayed relatively consistent over the last 10 years. Children enrolled in Medicaid have a higher rate of being screened for lead than the state overall, and this is because Ohio law actually requires healthcare providers to administer blood tests to children enrolled in Medicaid under age 6, although the rate is still only 28.5%. I'll also add that the percentage of young Ohio children who were tested and found to have an elevated blood lead level is low and has decreased over the past 25 years. Unfortunately, state funding for lead abatement initiatives was cut considerably in the operating budget that just passed. This included elimination of Ohio's Lead Safe Home Fund. Next, one thing that we know from lots of research is that trauma and adverse childhood experiences, or ACEs, can have significant impacts on mental and physical health. This slide shows the percent of children with one or more mental, emotional, developmental, or behavioral condition by the number of ACEs. We can clearly see here that as the number of ACEs goes up, so does the percent of children with one or more of these conditions. For example, of children exposed to 3 or more ACEs, 52% have one or more of these conditions. Many children who have interactions with the child protection and foster care systems have been exposed to ACEs and trauma. And we definitely see higher mental health risks among this population. A resource from the American Academy of Pediatrics said that up to 80% of children and youth in foster care have a significant mental health need. There were over 23,700 Ohio children in Children's Services custody at some point during state fiscal year 2024. Here's the age distribution. You'll notice that young children and teenagers make up the largest percentages. The most common reasons for removing Ohio children from their homes in 2024 were neglect and parental substance abuse. So that's all for my presentation. Like I said, there's even more information in the brief, including policy recommendations, so please go take a look. If you have questions for me, please put them in the chat and I will go over there and try to address them during the webinar. But now we're going to move on to our first speaker. I think I lost control of the slide. There she is. Lindsay Green is an educational connection specialist with 2 decades of experience serving children and families in a variety of roles. These roles have included kindergarten teacher, 2nd grade intervention specialist, home child care provider, infant and early childhood mental health consultant, and most recently as a behavioral health and wellness coordinator through Miami University's School-Based Center of Excellence. She is currently a 4th grade intervention specialist in Beaver Creek City Schools, her home district, where her youngest of 4 children and therapy dog attend alongside her. Lindsay holds teaching licenses as a pre-K through 3rd grade early childhood educator and K through 12 intervention specialist, as well as various other certifications. Through her professional development and consultation work, Lindsay is dedicated to helping others view relationship building as the foundation for education. She continuously explores emerging research in education and mental health to enhance her own practice and inspire growth in others. Lindsay, take it away.
Thank you, Becky. Well, I have to start with a photo of my family, my wonderful family, because Becky just shared a little bit about my background and also my very cute partner in crime, Dosito, who attends school with me and helps get a lot of buy-in from the students and the educators that I get to work with every day. So thank you so much for having me. I'm going to speak a little bit about how to help with screen time in schools and what we can do to help with the problem of too much screen time in social media. I think a lot of times we do a great job of defining what the problem is, and hopefully I will be able to share some of the solutions that we'll be able to use in schools and in your organizations to be able to support families and support children. So I always like to start out with connection, because really what our children are craving is more face-to-face, in-person connection. So it's really important in schools to get buy-in from all the adults who interact with children. That includes teachers, support staff, caregivers, any community members that are coming in to volunteer or support school, bus drivers, nutrition staff, all of the people who work with children need to understand the importance of their roles in connecting with children and helping children's social and emotional development. One of the best ways that I've found to be able to get that buy-in is to be able to speak to this picture that you'll see on the screen here, which is from a study called the Still Face Experiment. I like to start out with this because I think it really drives home the importance of connection. So back in the late 1970s, a researcher named Ed Tronick would bring moms and their babies into his lab, as you can see from the picture here. And he would instruct the moms to have the babies sit in a high chair in front of them. And they would play tickle games and they would play peekaboo and they would just have so much fun with each other. And just be connecting with each other. And then he would instruct the moms to make their face go blank and to stare at the wall behind their baby for just 2 minutes. And you would see that at first the baby would kind of screech and reach for the mom and try to get the mom to re-engage. And then the baby would start to cry and turn away and just become very, very upset. And it was just over 2 minutes. And after 2 minutes, the mom was able to re-engage with the baby, and you could see the baby slowly being able to calm back down again. And I think anytime we're thinking about screen time, we need to think back to this experiment, which again was done over 40 years ago, and think about if you've ever seen the way your face looks when you're looking at a screen. It looks very much like the bottom picture of the mom, that blank expression, just not connected, not plugged in, not tuned in. And I think we're running this giant experiment on our children where they're just not having that same level of connection that they're supposed to have. We're a social species. Humans are meant to connect with each other face to face. And so even though this webinar is on a screen, on video, screens are very important and we need to use them to help us, but we also need to be very aware of the importance of connecting with our children. And so anytime I have the opportunity to talk with educators or administrators, I like to bring up these 4 elements of connection that are so necessary to get in multiple times a day. So that's eye contact, touch, presence, and playfulness. So we need to be in the moment. We need to be connecting. We need to be giving high fives or fist bumps or even hugs if you're in a working with younger children, and having those playful experiences, because even in classrooms, we're noticing that kids are on screens more often and doing their own individual work, which is helping them increase their academics, but it's not helping with those social skills like they did when I was a kid and I was in a classroom. Even when we had a worksheet, we were all working on the same thing and we could kind of be talking to each other and connecting in some ways. Kids aren't doing that as much anymore. So we need to make sure that if we have the opportunity to talk to educators, or if you're an educator yourself, you're taking lots of moments to get these elements of connection in multiple times per day. So when I worked last year for the School-Based Center of Excellence, I really tried to drive this home to caregivers and educators in a multitude of ways. So one of the things that I did was we did twice monthly online sessions for caregivers. And I would send these flyers home and have caregivers join through Zoom. And I had a different topic every month where I talk about different elements of relational health. You can see from the flyer here, our March session was just on screen time, where I talked about the still face experiment and talked about how to limit screen time and what to do instead. Because I think we're really good at talking about screens are bad, online is bad. We don't want kids to be spending as much time in front of screens, but we need to give them ideas of what to do instead and how to set clear boundaries on those things. So It helped parents feel connected to school. They would come into school and they would see me there, and then they got to see me through these sessions too. And then they got to know each other a little bit better too in that online community so that they could connect outside of school as well. So something else that I did, oh, I think I skipped one. We sent home these different, this was one that we sent home at the end of the year, but just information on what to do outside of screen time. So this was our summer bucket list. The principal would send home a monthly newsletter, and she would always put happenings around the communities and just ways for families to get involved so they could feel more connected. So that's something else that I think is really important. Educators also need to understand the importance of connecting in the classroom because kids are more likely to be on a screen in the classroom too. They need to understand about how important brain breaks are and how to help kids with conflict resolution and to be able to regulate themselves, but then also to connect with each other too. So we talked a lot about those, and I would send monthly newsletters for the educators as well so that they could learn about these different things. One of the other things I did, just in case parents couldn't come to one of the Viking Village sessions, is I would record the video afterwards so that they could watch it on YouTube if they weren't able to attend. And then along with those monthly newsletters to try to encourage educators to watch some of the videos as they could earn professional development credit so that they could understand more about some of these mental health problems that were happening for our students so that they could go back and watch more of those too. So it's something that if you work with a school, giving them that option. I know we're talking about screen free, and yet we have ideas for that are on a screen. But again, we want to use it as a tool, not as something that we're using all of the time. And then again, I think that community involvement piece is really, really important too. So in my role as a behavioral health and wellness coordinator, really trying to give families ideas of what do we do instead of being on a screen, because screens are very easy. They're right there. There's no right or wrong way to use them in your homes. There are some parents that need to use a screen every once in a while for entertainment for their kids. And then we also need to help them feel like they're part of a community and part of a village so that they have other ways to help their children get connected. So at our school, we had student council, foosball club, after school club, and a lot of these were grant funded opportunities through the school-based center of excellence. So if you did want to get connected with them, they're always interested in having more people and more organizations work with them. But those were just different ways that we could get our kids more connected. And some of our kids that weren't doing great in school, maybe weren't attending school as much, the foosball club really helped them feel like they could come in and find something that they could excel at too. And it's more than just about sports. It's about other things that any student can do, no matter what their ability level is. And then we also had local volunteers and community organizations be a part of the initiatives that we created at our school. Really just trying to get everyone involved, because when we all connect with each other, we can all really make wonderful things happen. So those are just some of the things that we did this year to help decrease the screen time usage in our building. And I know there's so many other ideas too, but I did want to share what we did this year. And if you have any questions, I can answer them now. Or if you wanted to reach out, there's all of my contact information as well. So thank you for giving me the opportunity to share.
Thanks so much, Lindsay. That was a great presentation. I especially love how you called out the extracurricular opportunities for kids to interact in person. I think that's so important. And people were saying in the chat, thank you for the resources you were sharing as well. I wanted to mention one other one I'm aware of, the American Academy of Pediatrics Center for Excellence on Social Media and Youth Mental Health. That is a mouthful, but they have a lot of tools for educators, parents, teens themselves. So that might also be a good thing to look at. Let me see if we have any questions for you, or please HPIO team jump in if I'm missing any.
So someone asked what the resource name is again, and I don't think I added this to my slides, but one of the pictures that I had up there had a resource from screenfree.org. And that was a wonderful one that we connected with. Yeah. And then Becky, you said another one.
Great. Yes, and Tammy, I can put that in the chat while our next speaker is speaking. Okay, Lindsay, if you could stick around and monitor the Q&A in the chat, that would be great. Thank you again for joining us. Okay, we're going to move on to our second speaker, who is Andrea Pollock. Andrea is joining us from Chesterland in Northeast Ohio. She is both a former high school and middle school teacher. She has also worked in the area of youth employment for Catholic Charities and case management for Family Pride, and is now the program director of Next Step and the Chagrin Falls Park Community Center through Access Family Services. So Andrea, whenever you're ready, and Alana, I think we need to move the slide.
Good afternoon. Thank you so much. I'm just going to speak to you today about Next Step and the services we provide, and give you a little bit of my personal experience with youth homelessness. I am by no means an expert in mental health. These are just experiences that we've had with Next Step over the last 11 and a half years. We provide housing and case management in both Geauga and Portage counties to young adults 18 to 24. We have a 10-bed facility in Geauga County. It's an old century home. We are always at capacity, sometimes over capacity. So even though Geauga County at some point in time was a very wealthy county, we have our fair share of young adults who are couch surfing or coming out of their cars or out of foster care. Several of our clients are able to find some level of housing with a grandparent or a significant other, but then we are able to assist them with case management services. It's a voluntary program. There are minimal but important rules. We require everybody to either work or attend school or both. We want to make sure everybody has some way to advance in a career path where they can become independent and self-sufficient, and not have to repeat this this track of homelessness that they found themselves in at a very young age. It's important I wanted to provide a little bit of data for 2024. We were able to serve a total of 76 young adults in 2024 in both counties, and it's long-term housing. So some of our youth they're living there for 18 months, 2 years, until they're able to find something that works for them, that's more stable. That 76 number includes 32 women, 36 men, 3 trans individuals, and 5 who are non-binary. I feel like if you would take the United States and melt it down, you would come up with that same data for that Next Step represents. There's, primarily white males, but then there are some folks of color, and they represent different races and cultures. I thought it was interesting to see that ACEs slide from one of the first presentations. The 90% of our youth, their ACE score is 5 and above, so it's pretty significant. Of that 76 people that we served in 24, only 23 of those young adults recognized that they had some kind of a mental health traumatic background. Most of the youth, when they come to us, do not recognize that they are struggling with mental health. So that in itself provides a little bit of a barrier. We have to get to that point before we can help them really deal with any of the symptoms they might be having. We've noticed that usually our young adults have been exposed to family trauma of some sort, violence, divorce, neglect, bullying in school, domestic violence. They're often at an increased risk of chronic physical health conditions, which is something we were not prepared for. And in addition to their continuing mental health problems and their, which then becomes more realistic in academic and employment outcomes, those are negative as well. So it is really important for us to focus on on housing first, but then to address health equity. So in addition to first making sure that there is some kind of medical coverage, which is generally Medicaid, once we've made that, make sure that there's coverage for their we can address their medical needs. First, we address their physical needs. So we make sure they go to the eye doctor and to the dentist, which is always an issue because most of our clients have not had dental care for many, many years, if ever, and vision checks. And then we take them to make sure that, their blood work is good and to see if there are any long existing physical issues. So at that point, we're ready to really start addressing their mental health concerns. Again, homelessness, when you're homeless at 18 or 19, it's almost impossible not to be experiencing some kind of mental health symptoms. They might be temporary, they might be long-term, but it certainly has a very negative impact on their success, their future success. Some of our youth come with substance abuse issues, or they've been involved in the juvenile justice system once they're away from their families. And then, that also has such a negative impact on so many aspects of their lives. We don't force them to get treatment or to be involved with a therapist or any kind of other mental health, whether it's an agency or some other mental health provider, but we certainly do strongly encourage our youth to at least explore those possibilities. What we've found, particularly for young adults who have been involved in the system, if they have aged out of foster care, they are basically over it. They've already had so much intervention with mental health providers, and they're so jaded that it's difficult to get them to consider being involved with some provider as an adult because they've not had very much success as a child for the most part. They didn't want to have to explain how they felt or whatever was going on in their homes at the time. So that's been a bit of a struggle, but once we establish a relationship, we're very often able to convince them that they should go work with some agency, and we can provide those referrals and recommend that might be helpful to them. But of course, because the program is voluntary, and these are young adults, all these decisions ultimately are their own. I guess the common factor for all of our youth is that they really all want, and I'm sure you've all experienced this, they just really want the connection, the sense of belonging. They want to be accepted for whom they are and have their voices heard and some level of respect given. So that for certain is something that is in the forefront of what we do, with the hopes that they will start to feel that they have value and that being homeless is for us not an option. We want them to have stability and hope for the future. Ultimately, we want them to be independent and self-sufficient and be good members of society, without having to struggle for the rest of their lives or resort to activities that might not be healthy for them. What we've When youth come into our program, there's such a variety of personalities and types of reaction to being homeless. Generally, when you get to us, you don't have any other options. You've kind of hit bottom, you've worn out any family, any friends, you don't really have anywhere else to go. So, but we're not a homeless shelter, we're transitional. So we want to make it feel like it's a home. It's someplace that it's important that their existence is important. So, we expect anger and frustration and resentment and particularly lack of trust. But we work on trying to rebuild that level of trust so that they can establish good, healthy relationships. I'm open for questions, or I could kind of go on forever, unfortunately.
No, Andrea, that was great. Thank you so much. I especially loved hearing about how what they really wanted was connection and a sense of belonging, and your work and your organization tries to provide that, and then after that relationship is established, maybe there is a little bit more openness to some mental health services. So thank you so much for everything you do. I think we're going to have to move on. We have some good comments in the chat, Andrea. But we're going to move on to our last speaker, Dave Henwood. Dave has worked for Fairfield County Protective Services for the past 18 years as an ongoing caseworker, FTM facilitator, permanency supervisor, and now child and youth permanency manager. In his current role, he has oversight of the agency's adoption, foster care, kinship, and independent living services. This includes working with youth in need of permanency, as well as helping to identify services and supports for all children in agency custody placed outside of their home. Dave is a graduate of Ohio University, lifelong Fairfield County resident, and lives in Rushville with his wife, Jill, and two sons, Joshua and Nicholas. All right, Dave, take it away.
Okay, thank you so much, Becky. I appreciate that. I appreciate the introduction. I'll start by saying that all of those things just mean that I'm the old guy at work and I've been here a while. So I'm very excited, though, to get to talk with everyone today and kind of talk about how child welfare impacts the mental health of the youth we work with, and also how youth who are working through their mental health needs are often in our system, and what those interactions kind of look like and the back and forth that comes with that. So as we talk, I think one of the things that's important for me to acknowledge at the front is involvement in my agency's work and in child welfare's work is in and of itself a cause sometimes for the mental health needs of children that we work with. So we openly acknowledge and know that being involved in child welfare can cause trauma and bring trauma about. So it's important to kind of take that on face up and know that it's coming and have that be an important part of every conversation that we have and every decision we make as we work with families and help them make the decisions they need to make. Um, just some quick demographics, and also I want to acknowledge that some of these were demographics and information that Becky provided earlier, but to give just a real quick snapshot of who we work with and kind of the changing demographics and populations that we see in child welfare that have really shifted through the years. Um, as we talked earlier, more than 23,000 kids at some point in time in fiscal 2024 were in the custody of protective services. For us, for me particularly, because I do some of that later work on cases, it's important to also note that 1,000 of those children aged out of our system at age 18. So they left care without having successfully found permanency, and for us not having found permanency for them. So that puts them out into the world with some needs, and we acknowledge that as well. Um, 27% are more than 2 years in custody. So that's a long time, right? When 2 years is a long time period, but when you think 2 years of a child's life for them to be involved with us, that's significant. The 29% also for 12 and older, we see more and more of our work aimed toward teens. And as anyone who works in mental health knows, as you're hitting adolescence, as you're hitting those teenage years, more mental health needs sometimes can kind of come out and express themselves. Also, as everyone previous to me has talked about, there's also those other social needs that happen at those times. So, involving us at a time when it's already such a fragile state for lots of kids can be very difficult. I would be remiss if I didn't mention this too, and not to make this about money, but we spent $500 million in fiscal 2024 on the placement of children. And that impacts what we can do. And it impacts our ability to get to other services and to get other services to families. So that's always an important thing to kind of note for us. Not that it drives decisions, but it just drives what abilities we have to make decisions at sometimes. And it's also good to know where the kids are. More than half are in foster homes. A quarter are in kin. That's a number that we'd love to see higher. And that ties directly into some of the things I'm going to talk about today, because kids who are in kin are in their home communities. They're closer to home. They're with people they know. And that allows them to maintain the services that they need. It maintains mental health services. It maintains educational services. It keeps them locked in with the people that they already know. One of the things that kind of winds through everything that I will talk about is the acknowledgement that sometimes, in fact, often, children we're working with have their mental health needs when they come to us, and we're part of the community that's trying to help them with those. So, one of the worst things that can happen is when we have to pull them out of the community they're already established in and have them placed somewhere else. And the ongoing need in our state and across the country, honestly, for there to be more foster homes and foster beds, and there for be a greater involvement with kinship so that kids can stay where they live and stay with the providers they already have, is just super important. As was mentioned also earlier, ACEs is important for us to acknowledge and know. We sometimes are part of ACEs, but pretty much everything that happens where we're involved is something that adds to a child's ACEs score, right? All of those things. If you've ever looked at an ACEs questionnaire and kind of looked at the categories, it's important to acknowledge those are things that we get telephone calls about. Those are the reasons that child welfare becomes involved in a youth's life. And we often will see, and it's become more and more prominent through the years, we're not getting a call because there's a single thing. We're getting a call because there's multiple things. It may be substance use, but it may also be neglect. Physical abuse is a much wider range to look at than just a physical incident. There's other things that fall under that. So we can have multiple categories of involvement with families. There's usually one that introduces us to the family, but those things kind of have this broader spectrum with kids than sometimes we're able to acknowledge. And it speaks to the fact that almost a third of the kids who are currently enrolled in Medicaid have ADHD, anxiety, or depression. They're getting the mental health effects of what's happening. So it's important for us to make sure that we're kind of keeping that in our mind as we move along there. So um, also, one of the things that's important too to acknowledge is we're seeing more families come to us, and they're coming to us because they need help with their own children or the children that they have custody of. Teens, particularly, we have a higher need and a higher prominence for kids who are coming to us, and families are saying, I cannot meet the needs of this child in my own home. There's safety concerns, there's health concerns, there's risk concerns, sometimes for the child themselves, sometimes for siblings, sometimes for parents. And those families are searching for answers. Often, when they get to child welfare, what that looks like is a family saying, we can no longer do this. So we try to be good partners with other agencies in our community to figure out how do we address that sooner. That's one of the things that's probably one of the most important things I can kind of emphasize today is the more connectedness we can have in our communities and the more where agencies can work side by side, that allows us to get services to families faster and quicker so that they don't reach that point where they feel this level of helplessness where they can't raise their own child or their own adoptee or the child that they took legal custody of. What's happening, what's being done, right? That feels like a very depressing start to the conversation. There are services, there are efforts being made at a state level, at a local level, at a federal level. Many of you may be familiar with Ohio Rise. So we're a few years into Ohio Rise now. Ohio Rise is the state's programming through Medicaid to try to address some of these highest level need kids and to also make sure that there are services for the multi-system kids. So the kids who are working with different parts of their communities. It might be child welfare, it might be multi-system youth, it might be juvenile justice. But these are the kids where really there's the highest level of need, where they are brushing up against or in a position where they need to probably be looking at a congregate care setting. They're looking at a group home. They're looking at a residential facility. How do we address that? How do we help them? How do we help their families? How do we do those things so they don't get all the way to the end of the line and where families can be successful on their own? One of the things that was funded through the recent budget is the regional wellness campuses that the state is looking to start. That's going to hopefully give us an opportunity to use some of the resources to address short and medium term needs for kids outside of home, but also create a situation where they're able to transition back into homes or into foster care successfully. Our county, Fairfield County, is working with a group of southeastern Ohio counties for a facility in Gallia County currently, and we're trying to get that up and off the ground. So that hopefully will give some short-term care for some high-level needs where kids can be successful, get the services they need, and then jump back into their communities. Uh, I'm going to skip treatment foster because that's my favorite, and I'm going to talk about it for a second. But the state's also pushing initiatives toward kinship, such as KGAP, which is the Kinship Guardian Assistance Program. That's a financial support for families who take legal custody of kids. And like I said, kinship helps maintain kids in their own communities. It's much better for these kids if they can go live with their grandma or go live with their aunt, and those individuals can keep them linked with community and keep them linked with services. We're using services such as Connect to Family, which is a family finding model, which helps us build really, really extensive family trees and find where the supports and families are that sometimes child welfare has missed in the past. It's important for us to find those people and find who the important people are for kids. My county is in a collaboration with South Central Job and Family Services, so Ross, Vinton, and Hocking County, and we're one of 11 groups which is working on treatment foster care, and we're doing that at a county level. That's typically something that's been handled by private agencies. It's a kind of step up from what your traditional foster care looks like. It's able to meet the needs of kids differently. We're looking at additional services for kids. We're looking at higher training levels for foster parents. But again, it's the idea of keeping them in communities, also linking them directly with behavioral health support. So here are the 11 groups right now that are working together. Sandusky and the Northwest counties were the ones that kind of kicked this off and really got it going. But we're all kind of getting this up and running with the hope that if we can have some foster homes in our own counties that can meet these higher level need kids, we can keep them here. We can work with them. We can keep them linked with all the important people we have. We also can keep them linked with people we know. I don't necessarily know who the best mental health provider is on the other side of Ohio, but I do know who the best mental health providers are in Fairfield County. And I want to be able to link the kids that I know with them and keep that in place. So Those are the counties there. Like I said, we're trying to keep them close. We're trying to get caregivers who have that additional level of training and experience. We're also working on some modeling ourselves where we'll have what I'm going to call on-demand mental health services almost from the minute that the kids get to the house. We want them to be able to be linked with services immediately so that we can start addressing their needs, addressing why they've come into care, also addressing the trauma of the fact that they're in care, right? How do we help them feel more settled in those situations? If we can address those things early and not have to work on wait lists and not have to push through and kind of be like, we'll get you eventually something, but just be patient with us. Those are the kids who aren't successful. Those are the kids who the mental health kind of continues to expand and decline. And we want to avoid that. We want to make sure that we get them services quickly. So hopefully through our treatment pilot, we're going to have individuals in the home mental health professionals with those kids within the first 24 hours. We're going to be assessing them in the first week, and we're going to have in-home services for them. So we're working on all of those things. This is my last little pitch here. There's always more to be done, right? There's always more opportunities out there and more we can do. Anything that we can do to increase the level of care in communities is wonderful. If you go back to the first slides there at the beginning and we looked at the southeastern portion of the state and kind of that really dark color that came with the needs that they have, we live right beside those folks. They need providers. They need more folks in their community able to help them and help them with the services they need. We always need more foster homes too, and we need more kinship homes. We need more homes in communities for kids. We need a wider selection and menu for kids of the mental health services they can access. 12-year-olds aren't great at talk therapy, but there's other ways we can get to them, and anything we can do would be wonderful. And like I said, support for kin's always wonderful. We always love anytime that we have an opportunity for kinship providers to be involved because grandmas and grandpas and aunts and uncles and those folks, they know those kids and they can help them. So this is my information. I want you to feel free to take it down. If you have questions, feel free to reach out. If you have any questions, I'll be more than happy to answer them. But thank you all so much for your time.
Well, thank you to Dave for your presentation, and Andrea and Lindsay and Becky for your presentations as well. These have been fantastic. I have learned so much, and I hope all of you have too. And thank you all for being active in the chat and the Q&A throughout today's session. We really appreciate that engagement and hope that we or the presenters have responded to all of the questions that you had in mind. We're now going to go to our poll questions where we ask for your feedback on the webinar that you participated in today. This will only take a few seconds, so please stick around. Here's the first set of questions. They should have just popped up on your screen. There are a total of 6 questions right now on the screen, so you need to scroll down to respond to all of them. This is your opportunity to weigh in on the presentations you heard today and let us know how you'll use the information or the degree to which it increased your awareness of these issues. We'll give it a couple more seconds for everyone to provide their feedback. All right, Alana, are we ready to move to the next step?
I think we can give folks just another quick second. A lot of people are voting, but it's taking a second.
Great.
Thank you all. We see them rolling in.
While we're throwing the poll, and we'll just go ahead and switch to it once Alana decides to switch it. But if anyone is sitting with a question that you didn't put in the chat, that you want, hopefully it'll be a question that could, for which there could be a quicker response, since we're almost at 2, go ahead and unmute yourself and ask it now.
All right, poll is down. We can move forward.
Oh, did we get all the questions up?
The first poll went up.
Okay, so right now and let's go to the policy making slide.
I'm not sure it made it in the deck.
Oh, okay. Well, we hope that in addition to using the information that you received today in your practice and your work in your community, we're hoping that you will also consider using this information to influence the policymaking process as well. And this is just a reminder or a plug that our legislators and our elected officials at the state and local level are there to serve us. They are there to represent us, and they want and need to hear from all of us around the issues that are most impacting their communities. So please consider getting involved either through letter writing or phone calls, or maybe even providing testimony in legislative committees. There are many ways that you can get involved. And just remember that our elected officials are people just like us. They're deserving of the same respect that we're all deserving of. But none of us should be intimidated in meeting with any of our elected officials. All right, let's go ahead and throw the next poll. Thank you again, everyone who has stuck around to respond to these questions. We're very grateful. And you may be wondering what the HOODLE is. The HOODLE is the HPIO output and outcome tracking log. It's the way that we evaluate ourselves. So we collect this data so that we can always improve the presentations and the services that we provide to all of you. And then right now up on the screen is the Connect with Us slide. You can connect with us on LinkedIn. If you're not already, sign up for our mailing list, although I think by virtue of registering today, you'll be automatically on our mailing list. Please spread the information we share to your colleagues so that they're aware of our work as well. All right, and last, want to make you aware of a very important date coming up, and that is the date of our second annual statewide health policy summit, which is going to take place in Columbus at Columbus State Community College on Thursday, October 9th. There will be a wide array of presentations throughout the day and a track that's focused on child-related issues. And in addition to a track related to working age adults and a track related to older adults. So please mark your calendar for this. Registration is going to open in the coming weeks. So you'll receive those emails. There will be an early bird registration option, which will save you or your organization a few dollars. So consider registering early. Last year, we filled up pretty early. So yeah, so be aware that that'll be coming your way. Again, thank you for attending today's webinar. We really, really appreciate everything that you all do to serve Ohio's children and make sure that our state is a place where everyone can thrive and reach their full potential. Enjoy the rest of your week. Bye.
Thank you, everyone.